every symptom going on is either done by the brain or because the brain failed to do the better thing.
Mm.
So
Mm.
that's the basis of everything that I've done. All of my gummies are based around the idea that we're trying to support the brain to give it the best resources to allow it to normalize human greatness.
Yeah.
Not just here's another B vitamin because you need more B vitamin. It's how do we support the brain to use your epigenetics to make you the best version of yourself?
Yeah.
So in all things, the brain is key and number one. The second
Mm.
rule for being human is that everything is a resource management issue.
Yeah.
So all of the resources like water, supplementation, love, stimulus, they're all incredibly important. But there's a couple that really stand out, which forms rule 3, 4, and 5. And 3 and 4 came kind of a bit later on in my story. And rule 3 is everything is affected by the quality of your sleep. If you don't sleep, you don't heal.
Welcome back to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host, Jodi Duval, and today we are back and joined by a truly unique thinker in integrative health, Dr. Scott Wustenberg. Now, Dr. Scott is a chiropractor, a clinical nutritionist, and functional biochemist with over 2 decades of experience. He dives into the most complex of subjects. He is leading innovation in brain-based therapies, primitive reflex integration, and neurodevelopmental health. And we talk about so many things in here that blew my mind. So pretty much this is what we go through. His history that we talk about in terms of how he grew up in chiropractic influence, and then he brought some techniques into Australia, surrounding the sacro-occipital technique, and then how his mother used to practice herbalism and nutrition, and that's sort of foundationally in his upbringing, and then into graduating chiropractic medicine and looking at and doing a double major in biochemistry and physiology at Auckland University. And so later pursuing postgrad studies in neurorehabilitation and also a master's in nutritional medicine. So really the catalyst was for his family when his daughter regressed into autism at 18 months and became nonverbal. And so his sole purpose was to create a system and support for his daughter, his family, and to know how best to treat that. So here comes a lifetime of learning and diving deep. So he did realize then that continuous supplementation backed long-term regulation and inspired the brain-centered approach. So his 5 foundational rules for human optimization: the brain is everything, resource management is central, sleep quality governs everything, breathing, especially efficient CO2 balance, and movement drives brain development. So those we discuss in detail. We also look at the importance of chewing and the gummies that he has created that I now have in my clinic and I love using with clients. And so chewing activates the vagus nerve, promotes the parasympathetic rest digest, and the gummies provide an easy, safe, and pleasurable delivery system, especially for the neurodivergent individuals. And the sweetness is actually used strategically to trigger oxytocin, dopamine, and improve supplement compliance. So he designed his range of clean, allergy-friendly, low-toxin gummies for his own children with autism, ADHD. So really, we look at also talking through that oral component, the tongue and oral ties. And so we go into that as well. There is a lot that we go through. So without further ado, we need to get into this podcast. But please, before we dive in, I'd love to remind you to please take a moment to leave us a review, share and like this episode if you find it valuable. It really helps us to support this more and those who are curious about optimizing their health. So again, without further ado, let's welcome Dr. Scott to the show. All right, I have the wonderful Dr. Scott Wustenberg, and I think I might have said that right or not. I don't know.
It's pretty close. I pronounce it Wustenberg,
Wustenberg.
but it took me a long time to figure that one out when I was little. So,
Oh, yes, I am. I'm still learning names. So, welcome to the Smarter Not Harder podcast, Dr. Scott, and I really appreciate your time being with me today. And we have some very juicy topics to talk about today. I'm very excited.
Thank you. Thank you. It's great to be here, and I am quite excited about the range of things that you're interested in.
No, absolutely. So I first came across you, and I want to find out, more about you in a minute. But I first came across you with the products that I was seeking out to get good quality supplements of what I wanted to try and compound into a gummy myself that I couldn't. Couldn't for the life of me create a nice tasting gummy, and you have created so many, so many. So blown away. And then I dove into all of your expertises. Exactly. We have a whole range there. We've got a pretty good range here, and they are flying off the shelf. And the success of what they are providing is the most important part, I think, as well. So
That's awesome.
we will get into that. But tell me your personal story. How did you land in chiropractic medicine, nutritional medicine, research, books, courses, clinician, everything? Tell me what prompted you or what brought you to this place.
That's a really kind of broad.
It
I
is.
was I fell into healthcare partially because my uncle is also a chiropractor, and he brought sacro-occipital technique to Australia 50 years ago. So
Mm.
I grew up in an environment where chiropractic was there. I was adjusted from 2 weeks of age onwards. My mother did herbalism and nutrition as part of her, you'd call it perhaps a side hustle now. That was her area of interest when we were growing up. So, like, you couldn't be sick at home because she'd make you something really obnoxious with like black cohosh or eucalyptus tincture. Oh my goodness. So if you were sick, you were really sick because she would do something that was vile and you needed to be properly sick to want to go through that. Now,
Sounds
that
familiar.
yeah, that led to a kind of process. Like, I went through high school and I was going to do business studies and economics and accounting, and I'm going to go to university and do that and follow my other uncle. And I was sitting in a class about August of my final year, and I just went, "This is boring the pants off me. I can't do it for the rest of my life," and decided at that moment to become a chiropractor. And so went through the process of trying to apply for college. I actually got into the very first class of the New Zealand School of Chiropractic and graduated in that first class, and then have evolved kind of there. But to do my degree status with the New Zealand School, I actually did 2 degrees at the same time, one at Auckland University and one at the College of Chiropractic, because we actually had to have a a recognized degree from a recognized institution to prove that we were actually of an educational status to meet their like, because it was the first graduating class, they had a greater strictness to prove that we were actually of a quality. So I did 2 degrees at the same time. My first degree is actually biochemistry and physiology. So I did a
Wow.
double major there and a chiropractic degree, and I didn't sleep an awful lot, which I
No.
look back and I regret.
Yes, yes. Now I'm trying to fix all of this and helping others to do the same.
Yeah, I really didn't have a great thought process. It was like, if I don't have to sleep, I could be so much more productive. And now I look at that and go, that is wrong thinking. If you sleep more
Yeah.
and sleep better, you are more likely to be productive. But, it was just a sign of the times.
Wow, that is incredible. So, and biochemistry is a in-depth place to start as well. So, hence why you have so much knowledge in what we're going to talk about today. So,
Absolutely.
all right. So I guess, when we're clinicians, when we're in this field, there's so much that we see and we want to help, and there is suffering. And so I guess, where do you want to start? How do you feel that, what do you see in your practice now? How's it evolved? Where are
Oh,
you focusing, a lot of your time on now? Because I know obviously, your initial supplements probably would have evolved for a purpose, and then going into and evolving through change as well. And then obviously what you do with your chiropractic medicine as well.
So I suppose I should start with the basic context of how I got to where I am at this moment. And
Mm,
all three of my kids have some degree of special needs. So my eldest daughter was neurotypical till about 18 months of age,
mhm.
and then stepped off the planet into the world of autism from there on. And by four was non-verbal, non-toilet trained, staring into space, literally finger painting poop on walls at different moments in time, which was horrific.
Wow.
And chiropractic at that point and the work that I did made not a jot of difference to her. We went to the standard GP, we went to pediatricians, they shunted us sideways to the OT. This is, 18, 20 years ago. So this really didn't give us any support, any help. And so I believe that the children pick us to give them the best start and support them to grow them into being the best version of themselves. So
Mhm.
I couldn't accept that that was the limit of Megan's future capacity.
Yeah.
So it forced me to retrain. And so
Mhm.
I went down the rabbit hole of nutrition medicine, integrative medicine. I did my master's in nutrition medicine. I have a fellowship with the Australasian College of Nutritional Environmental Medicine. I've trained with AMA and ACNIM and the Mind Foundation, and I've looked at the rabbit hole and the plethora that is um, integrative medicine for the autistic ADHD space.
Mhm.
And all of the work, all the things that we did made a difference.
Mhm.
But the problem with that work is it has this never-ending upregulation of, okay, just add this, that tops out, just add this. And it was all about just adding more resources, and there was never a normalization.
Mhm.
And
Mhm.
so again, my preconditioning from the chiropractic point of view, as well as biochemistry, physiology, is that we're meant to be helping patients normalize, not just add and add and add and add and add, and because it gets difficult. You cannot give just this infinitum amount of supplements or drugs or otherwise to people and expect a good outcome.
Yeah.
Now, we did get a good outcome, but it was always this, okay, that's topped out. We haven't got there yet. We haven't got there yet.
Mhm.
So it brought me back full circle to go back to studying. And I did my postgraduate research and studies in neurorehabilitation. And
Mhm.
it gave me the basis that actually formed part of my book, which is that the beginning of everything is the brain.
Mhm.
So everything that we are, every symptom that's going on in you at this moment in time, apart from immediate direct trauma, I punch you in the face, you don't expect that. But from
Mhm.
the moment of impact, how your brain deals with the snap, the muscle grab, the inflammation, the healing, everything is driven by your brain for your best survival. So
Mhm.
most practitioners don't have the brain as their very first thought in everything. Every symptom going on is either done by the brain or because the brain failed to do the better thing.
Mhm.
So
Mhm.
that's the basis of everything that I've done. All of my gummies are based around the idea that we're trying to support the brain to give it the best resources to allow it to normalize human greatness. Not
Yeah.
just here's another B vitamin because you need more B vitamins. It's how do we support the brain to use your epigenetics to make you the best version of yourself?
Yeah.
So in all things, the brain is key and number one. The second
Mhm.
rule for being human is that everything is a resource management issue.
Yeah.
So all of the resources like water, supplementation, love, stimulus, they're all incredibly important. But there's a couple that really stand out, which forms rule three, four, and five. And three and four came kind of a bit later on in my story. And rule three is everything is affected by the quality of your sleep. If you don't sleep, you don't heal, right? You
Mhm.
can't grow, you can't thrive, you will decompensate. And of course, Megan was a terrible sleeper. As it turns out, all of my kids were terrible sleepers.
Yeah.
And we missed some of the major important things very early on that if I'd found them in that first year, we'd have probably have had a really different outcome for all three of my kids.
Yeah.
But, they taught me lots and lots, and other people have benefited from that. So
Yeah.
I try to hold that concept in mind when I get little sad moments about it.
Of course, of course. It's all learning.
So sleep is incredibly important. And if it's fragmented, the brain doesn't do things quite so well. It loses energy. It doesn't detox as effectively. It doesn't drive your hormones in a growth trajectory. It puts you into survival state.
Mm.
So rule 4, everything is affected by the quality of your breathing and gas exchange.
Mm-hmm. Mm-hmm.
If you don't breathe, you don't thrive. In
Mm-hmm.
fact, obviously, if you don't breathe for like 4 minutes, you're kind of dead.
This episode is proudly brought to you by the Home Hope Gut Immune System cohort that is coming from the module. First time we are doing this, and it is going to be on July the 7th of this year. And we normally have the clinical metabolomics as a cohort, but it's the first time that we're stepping out of our comfort zone and we are going into the gut immune system. And so this is because we have been asked by so many people to put this on, and it's going to be an incredible opportunity. So this is a groundbreaking clinical training as part of the Health Optimization Medicine and Practice certification. And so it is designed for health professionals ready to transform their understanding of the gut immune interface. And so we do recommend doing and having the clinical metabolomics to actually step into this. So ask us questions if you need that. Send a message across to homehope.org. But in here, we'll learn all aspects of the gut immune system. So won't waste your time, but look into it. Have a look on the website. So visit homehope.org /product/gut immune cohort. And that's where you will find that. And myself and the team, the whole faculty will be there with you every step of the way and guiding you through the modules, and students and feedback and curiosity and conversations. Amazing. So now let's get back to the show. Enough with my rambling, and we will get back with Dr. Scott. Yeah.
Right? So,
Very
so
important.
the platform is based on this really simplistic, it's do the best thing or the alternative is death. And if you don't
Yeah.
look at it from that very fatalistic kind of viewpoint, we kind of make stuff up to go, oh, it's not that bad. Don't worry about that. And from the brain's point of view, we're I call us kind of angry chimpanzees with better sticks. We are not these sophisticated, wonderful creatures, the beautiful thing that you are with earrings, etc. We are survival organisms, but
Yeah.
because of our better decision making, maybe, than some of the other mammals out there, when we go into survival, we can either make really great decisions or really, really terrible decisions. So
Yeah.
the goal is to make sure the brain has its resources, which includes oxygen, carbon dioxide, gas exchange, sleep, etc. So the problem is that if you have things like tongue tie, oral ties, small jaws, small noses, etc., you will commonly fragment your sleep because your airway is now under threat and your brain cannot have your airway under threat at all. And there's a
Mm.
whole bunch of reasons behind this, but I
Yeah.
miss my kids' tongue ties. And
Mm.
so this has become a really big part of how I approach all of my patients. Everything is from a neurological point of view, but as it turns out, all of the cells that form the cartilage that forms the points of your cheeks, your nose, your jaw, the oral fascia, these are all neural crest cells, which
Mm.
migrate at about week 5 from the neural cord. So they're all neuronal tissue, meaning that all of your facial development is a neurodevelopmental consideration. And therefore, if there is a problem, that means you have a neurodevelopmental disorder. Because at the same time as the face is developing, the wiring coming from what becomes the spinal cord is invigilating into that tissue and helping teach the brain how to move your facial structures, your breathing, your airway, your suck, swallow, and breathe patterns, and drives
Mm.
the primitive reflexes that I deeply look at and look at with every one of my patients, because If there's a problem with how your face and your tongue develops from week 5 onwards, it will cause a compensation in every part of your neuronal wiring to make your frontal lobes work, and you will decompensate. So we find lots and lots of adults will actually come in with their primitive reflexes intact when we shouldn't expect them to.
Yep.
So
Yeah.
rule 5, therefore, is everything is impacted by the amount of movement going on for you. Now, chiropractors will commonly think about movements towards joints or muscles, perhaps, so will lots of other body worker type patterns, but it's not just adjustment of a joint or strengthening a muscle. It's the movement of repetition, because we wire up with repetition. If you don't do enough movement, such as you're not moving your tongue to the roof of your mouth effectively all through the pregnancy and beyond, you're not going to wire your frontal lobes, and you're more inclined towards anxiety disorders, poorer attachment issues, such as the whole point of suckling and perfect tongue movement in the breastfeeding in those first moments is to create dyad bonding with mum, right? So if there's a problem there, we don't get the oxytocin release to go, that's the best thing in the world. Wow, look, I just, innately love you.
Yeah.
And like I'm anthropomorphizing that kids at 1 day of age are going, I love you. But there's that connection, and it
I know it's
starts with tongue mouth movement and breastfeeding. And from that moment, the first suction and suckling, eyes go up to mum's face, which activates the tonic labyrinthine reflex and the neck muscles, creating an extensor tone. And that's the very first movement outside the body that drive your primitive reflexes to start working. So if there's issues with your midline structure tone, either too tight, too kind of flopsy, you don't start driving your primitive reflexes to work properly. Hence, as a 15-year-old, if that problem still exists, you're going to have a whole lot more problems, including indications towards things like ADHD or anxiety disorder.
Wow, that was a tour de force. I love that. That is a lot to unpack. So good. Okay. So yes, I think I'll just touch from the end point there as the breathing. From my perspective with clients, I've been through this with my children. I've done expansion. I've got a very good dentist who is a friend. I also see chiropractors, a lot with all of them. But from the expansion point of view and the breathing point of view, and speaking to Patrick McEwen and all of these experts like yourself in the field, it's so apparent how essential all of this is to the adult conditions and issues that I see in clinic.
Absolutely.
So yeah, I absolutely am on board with everything that you said there. So, I guess let's talk through. So that obviously you've got the rules there, which are incredible. So from a perspective of impact, and I love what you said about having too many things and constantly layering on for fixes, and because
Yes.
it gets exhausting. And so I see a lot of complex cases. You see a lot of complex cases. When you say to someone that you got to do this and you got to do that and you got to do this and you got to take that, it's too much. They don't even have the capacity to do that at that point. And so, yes, when is there a foundational measure, or when is there a point of rest, or where is there a point where you can actually come to go, okay, now is the rest point, or now is the point where we don't have to do too much, and what is it that we've got going on right now? Okay, next goal. And so I guess that's that confusion between so many different modalities, when we've got different referral networks, and we've got the medical system, and we've got different specialists and all these things. So to clear that right at the beginning, so I think a lot of people listening to this will have very empathetic stories of what they experience on a daily basis, including practitioners who deal with this. So how do you start with patients when you actually have that, coming in and you talk to them? And obviously it is always going to be personalized, but how do you make things easier for them, or more from perspective of how you look at these treatments and the importances of all these rules that you talk about, and one of my questions is like, why gummies? And because not only do children love these in the right
Yes.
doses, but adults are taking these off the shelf like they've never consumed these before.
Yeah.
And getting the results from them. So that was a loaded question in that,
Yeah.
you know, we can do things that are easier for people and more pleasurable for people to make changes. And so let's have a discussion around that, I
Okay.
think.
So there's a bunch there. To answer
Yeah.
the gummy question, it's very simple. Everything is brain-based. To
Mm,
get best absorption, you have to chew your food to activate the vagus nerve. So if you go back to first principles again, which is the joyous name of my book, so I'll throw the
yes.
self plug in. First
Yes.
principles, if you remember a moment ago, I said it starts with suckling. Now, what occurs with that first suckle is we activate the nerves in the mouth and we activate the suck, swallow, breathe reflex. But a
Hmm.
moment after that peristaltic action starts, the muscle movement to go and take the bolus all the way down to hit the stomach. When it hits the stomach, the vagus nerve activates and sends a signal to the brain that releases oxytocin. And the oxytocin starts the wiring, which then binds in the release through the mu receptors and different parts of the deep center of the brain. It releases serotonin and dopamine. So
Mm,
that action from suckling to activate the vagus nerve has to have a mouth action, which is starts with suckling and
mhm,
then moves into chewing. That has to have a reward sensation of activation of a food-like substance in the gut for the brain to go, I'm safe, right? So the basic context of
mm,
that is if we don't chew our food, our supplementation, our nourishment, the brain via the vagus nerve is not very interested and it will not activate for best absorption.
mm,
So chewing is critical for the brain to actually bring absorption of nourishment into the body. Now, the problem that everyone forgets is that a tablet can be conflated by the brain to be like medication. And
mm,
medication indicates to the brain, even like a 3 or 4 year old, medication means I'm sick. I get medication when I'm not good, right? That is a
mm,
very different state of being than I'm in rest, digest, and calm, happy. So sick is fight, flight, and you don't digest and absorb well when you're in fight, flight, running from a bear, right? So we are trying to put all of our candidates, all of our patients, all of our people into as much rest, digest, because rest, digest is open, right? I'm in a cuddle zone. Fight,
mm,
flight is I'm not in a cuddle zone, right?
mhm,
So from the gut's perspective, and again, go back to first principle, I bind to mum, I suckle, I look up, that is the greatest, most magnificent thing in my universe. It's a
mm,
infinite love loop that activates the vagus nerve back to the brain. And we have to make our nourishment interesting, salient, and ideally, I went with the idea of trying to make it delicious. So when the child is born, it has sweet salt, right? We
mm,
only have those two flavors.
mhm,
Everything else is a learned response from there.
mhm,
So if I would go back to first principles again, I need to use either sweet or salt to activate those parts of the brain that become interested and motivated to want to take nourishment and put us into a rest digest rather than a survival state. So that's the basic context of why gummies. Second, behind that, though, is I went to the integrative doctors. I went to the autistic specialist. I said, you have to give Megan activator B complex and you have to give her zinc and you have, she didn't like any of it. I had to, in the end, inject her with B12 on a daily basis for years because I
mhm.
couldn't get her to take her supplements.
Yeah.
She's not super keen on that. So the supplements, the gummies rather, that I made are what I wish I had for my daughter when she was little and unable to be in a state because she was in chronic fight flight.
Yeah.
She just
Yeah.
wouldn't take. Now, what was really interesting, and it's part of my observations, I could give her the most beautiful meal with like
Mm,
broccoli or sauteed cabbage, a lamb cutlet, etc. It's got lots of lovely green, it smells nice, and she wouldn't touch it. She literally would do this. And there's nothing that says disdain like a 5-year-old turning its head and blowing you a raspberry, I tell you. Right? But if I bought out spearmint kind of leaf gummy lollies that are the same bright green as, like, she'd eat the bright green, not that we actually did this, but she would hunt for the sugar, right? So everyone out there in the naturopathic and integrative doctor world, sugar's bad, right?
Yeah. Yeah.
It's just a tool, right?
Yes.
If we give a, half a kilo of sugar, that's a very different animal to 2 grams of sugar to activate a part of the brain that says this is safe and nourishing to you, and then getting the vagus nerve and the digestive tract to become involved and actually absorb the nourishment effectively at that moment in time. It's entirely based on neuronal principles to trigger absorption. And again, I can now get all of my kids to take their supplements because even at 21, 22 years of age, they still were resistant to doing what was best for them.
Yes. Agree. I've got a 13-year-old and it's still tricky, and I never thought it would be.
No.
This episode is also brought to you by Troscriptions, my favorite. The makers of physician-formulated, precision-dosed buccal troches designed to elevate your mental clarity, your mood, your calm, your sleep, your mitochondria. And so Dr. Scott here speaks about the depth about supporting the neurodevelopment and stress regulation. TroCalm is a tool we love for those seeking better parasympathetic balance. And so TroCalm is specifically formulated to reduce and support anxiety, to promote relaxation, and to support restorative sleep. Really on the purpose of GABA induction. It's a perfect companion for those navigating neurological overload, trauma recovery, or high stress environments. So if you head to troscriptions.com, you can use the code POD10 for 10% off your order, and you can try it for yourself. So now back to the show and Dr. Scott and his transformational work in brain-based healing.
No, you'd imagine that they would understand and just want to do what was best for them.
Yeah.
But they are hardwired to avoid things that might smell like poison. Like,
Yes.
there's nothing about an integrative B vitamin capsule that smells delicious.
Mm-mm.
It
Nope.
smells toxic,
Totally agree.
unfortunately.
Totally
So
agree.
when people are in fight flight, their sensory systems wire harder so that the smell of something that could be dangerous becomes more threatening, so they avoid it more. And we wire in a part of the brain called the insula. Now, the insula gives us the flavor of suffering. It gives us disgust. It makes an activation to a portion of the brain called the nucleus tractus solitarius, which, if you wire that in too hard, will give you vomiting. So they become really avoidant because it makes them nauseous.
Yeah.
So we have to get the tongue involved in an almost pleasurable way and engage it in a fashion that is completely non-threatening. And that is the basis for how I built my products.
Wow. I love that I know this now. And it doesn't make sense. It's something that I naturally have been trying to do for my clients, but not knowing the theory or the context behind it. And wow, I love this. So yeah, a spoonful of sugar makes the medicine go down. My Mary
It
Poppins.
really does. And it's such a classic line. Now,
Yeah.
I'm trying to reduce it so it's not really a big spoonful of sugar.
It's
And
not.
again, we've combined like some xylitol in some of them because some of the products we're going to stack together. So I've tried to kind of mix and match a little bit with reduction of the amount of total sugar. Now, we use maltose in almost all of them, which is a cell signaling sugar. It doesn't have a rapid spike in blood sugar, but it is sweet. So it makes the brain very interested. We've used natural fruit as our flavoring and coloring. We don't use preservatives. We don't use any artificial things. They are gluten-free, dairy-free, because they've had to be everything to not upset my children's systems. So for all the people out there who are looking for a product, I designed them for my kids. One's got mast cell activation syndrome and autoimmunity. One's got Asperger's with ADHD. The other is ASD. We built them to not have the phenol salicylate hyperreactivities. We have no oxalates in them. we've tried to make them as clean as possible for everyone. The other real key thing that I tried to avoid, there is no omega-6 oils in it, which
I
I'm,
noticed that. I
yeah,
really
I'm
appreciate that.
dead against them. But it says vegetable oil, which is the canola wax and
Yeah,
the coconut oil in it.
same.
And so they're there as part of the process to make it flexible and give it the gummy consistency. But there
Yeah.
is no omega-6 like canola oils or otherwise in them.
Yeah, I really appreciate that. And it's the power of trying to create a solution to a problem that's so close to your heart that now gives great benefit to many. So
Yeah,
it's just an incredible thing. And this is, I guess, the back to the point of, not feeling sad or guilty for the circumstances that we get ourselves into or is
absolutely.
given to us. We make lemonade out of lemons, and this is exactly the case. And I love that. Yeah.
It
So
was one of the things with the girls is, of course, as you were saying about the expansion earlier on, the interesting thing, because we did expansion with my girls and we got
mhm,
their teeth meshing perfectly, and I did all the right things. But I raised a critical point because the tongue ties and the fascial tie was still missed at that point. And so,
right.
especially with my youngest, we got backsliding of the bite because the fascia is still applying the tension to the bone structure, which is not rigid in a
Mm,
14-year-old. And
mm,
so it's really important because, again, I don't believe if you do the right work and you get the stress off the bone structure and it's meshing and growing effectively, you shouldn't need to have permanent wires to retain your bite structure.
no, I
But
agree.
that's how lots of the orthos tend to do things because it creates a force to stop the bones up until such point as they harden long enough. Now, one of the problems that I find quite commonly and have seen from the literature is there is a downplaying of the significance of the oral ties, tongue
Mm,
tie, buccal ties, especially.
mhm,
I have cases, like I have a case that we saw last year that we did the primitive reflex work on and rehabilitated, had the tongue tie released, including buccal ties. And she
mm.
went from having 100 seizures a day to having 2 seizures in 6 months post surgery.
Wow. Wow.
Ties are neurologically active. They affect all the movement of your face, which affects all the wiring up of the brain. And
Mhm,
if you leave the person in a fight flight scenario, airway fragmented because the tongue is pulling down and back, the cheeks are pulling in the wrong direction, the primitive reflexes cannot move past that point.
mm. Yeah,
So when they go to sleep at night, the tension is going to pull down and back. So where will the tongue end up?
yeah.
In the airway,
In the airway.
right?
Yeah.
So the brain cannot cohabitate space with a closed off airway for any great length of time. And in fact, as it turns out, hypopneas and snoring and sudden occlusions are actually more dangerous for the brain than apnea is. So the brain can tolerate not breathing for a longer period of time than it can actually tolerate short on off or sort of tightened airway. That
Mm,
actually causes reperfusion injury, which creates much, much more oxidative stress in the brain and is more associated with seizure activity.
mm,
All of that facial tone discrepancy is associated with an inability to activate mirror neurons to be able to understand people's facial expression and mimic them to learn what emotions are, which is
mhm,
why tongue ties are very, very common. In fact, I've never seen someone on the spectrum who doesn't have tongue and oral ties. They are
mhm.
all completely associated with things like MTHFR, which is highly associated with autistic spectrum disorders.
Yes, absolutely. And again, personally myself, both my children had tongue ties and we got them corrected. And it was early days, I was reluctant. My son was my first baby. and the midwife picked up on the tongue tie and they said, you need to get this sorted, a couple of weeks old. I'm like, oh no, you're not cutting anything in my baby. Absolutely not.
Yeah.
And so researched it, saw some of this information, or although it wasn't all around then, but then realized, oh, this is important.
Oh,
Okay. So I'm so
oh,
glad I did, but it was traumatic for me, not him.
absolutely. I can absolutely understand that.
Yeah, yeah. So, all right. Now that's incredible. I've still got so much to talk to you about, and I want to get to the domestication theory, but I wanted to talk to you, just go through the breathing is such a big issue and sleep is such a big issue in people. And so we've talked about breathing and airways and, even the tongue positioning and the neuronal connections and the safety and all of this sort of really important components of being healthy as a human and happy. So yes, and we're seeing a huge rise in some of this neurodivergence. And so the domestication is what I really want to get into. But let's talk about sleep quickly. Like, what is
Yes.
your key tools, tricks, tips about sleep? Obviously, breathing and oxygen is a big one. But what are the other things that you've noticed, created, and seen?
So I'm going to go out on the opposite limb and say,
Okay.
actually, it's carbon dioxide that's the important thing there.
This is Patrick's
Yeah,
stuff as well. Yeah,
absolutely.
yeah, yeah, yeah.
And so I'm pleased to say I met a chap by the name of Roger Price maybe 15, 17 years ago. And Roger is a breathing physiologist amongst many, many other things. He's been in the health industry in and around this area, breathing, sleep, airway, posture, for the last 60 years, roughly.
Mm,
And his work taught me about carbon dioxide actually being the most important thing. And then later on, more interesting and famous people started bringing this up. But the
mhm,
problem is that the average person out there thinks about breathing in relationship to oxygen,
mm,
and it's really about the perhaps over breathing and excess of oxygen that's getting most of us into trouble. And so what we really need to be doing from a breathing perspective, as I see it, is trying to actually increase things like the Bolt score, increasing that carbon dioxide level so that you can actually release oxygen into the neuronal tissue and
mhm,
actually start stabilizing the membrane so that the firing level of your neurons actually calms down, because excess oxygen and low carbon dioxide equals acidification, oxidative stress, and damages your nerves. Now, long term in the brain, that equates to dementias.
mhm,
I believe that ASD to a large degree is a mirror of dementia. It's just occurring at a younger age before you had your moral majority. It's the same
mm,
physiological biochemical mechanisms.
mm,
So we've got
mm,
lots and lots of oxidative stress. We've got lots and lots of compensatory mechanisms. But because the brain hasn't kind of got to a high point, it's compensating from a very low base. But the brain is basically putting you on trickle charge to go, look, the land of milk and honey is just over there. We've just got to get through the door. Let's shut that down, and we decompensate. So the first thing that I'm trying to get done is a reduction in the acidification and the oxidative stress, and we focus on trying to build up the carbon dioxide level. So I will use some really simple things like breathing into a brown paper bag,
mm. Yeah,
or holding the
yeah.
nose and walking, and head shakes, focusing on flushing the sinuses. I use saline flushes and neti pots. Again, trying to get them into an arguably meditative state in the time before going to bed, reducing all of your excess blue screens if you possibly can. Now,
Mm,
surprisingly, I'm not a major fan of blue blocks and blocking
mhm,
glasses,
mhm,
because what's not well understood is that color affects your brain. It's
mm,
not just a color frequency of too much excitation from the blue light. Color and light is a waveform that affects your skin. It We are piezoelectric generators, and we release light, and we need the electromagnetics of light spectrums going into us to activate everything about us. So my preference isn't just stick a pair of blue block glasses on,
Mhm.
it's change your environment. There are, like, I'm waiting for my daylight computer, which has got no blue coming from the screen whatsoever. I'm
Yeah.
trying to buy the
For that.
Sora bulbs that will automatically switch to
Mhm.
having the violet light spectrum in it. So you still get a clean white light,
Mhm.
but it doesn't upset your circadian rhythm. So
Mhm.
it's trying to change your environment rather than trying to, like, blue blocks, in my opinion, are about the same as just using a supplement as a band-aid to fix things.
Melatonin.
Yeah. Now, I use melatonin and I love melatonin. And
Mhm.
like, I have lots of arguments with different people. Melatonin is a fantastic antioxidant. It is a
I agree.
brain rhythm reducer. But
Mhm.
like, you can use it at high doses to stop stage 4 cancer. There are doctors out there doing it. So
Yeah.
I think a lot of the people who are very anti it really haven't looked hard enough into the melatonin physiology. Now, is it the solution for putting you to sleep? No, of course it's not. All it does is slow your brain rhythms down. And, there's a whole bunch of other things that you could be doing to slow your brain rhythms down. I use things like magnesium threonate. You could use L-theanine. I use adenosine to try and actually, because that's the actual technical sleep pressure nutrient for the brain.
Mhm.
We focus actually from the flip side on building lots and lots of energy in people using things like creatine or the MitoVital product to build mitochondrial function. Because if you don't have enough energy, you can't sleep, because your brain actually spends generally more energy while you're asleep repairing you, resetting you, cleaning you than you actually do when you're awake, which is why
Mhm.
lots of people who are chronically tired can't sleep, because they don't have the energy to go through the wave fronts when they are asleep. So there's a whole bunch of stuff that I do. Again, we try and keep the room temperature nice and low. Um, During the day, I recommend things like cold plunge and infrared saunas for people. It's
Mhm.
trying to set circadian rhythm, but if you haven't put the person into a rest digest state and actually made them feel secure, sleep is quite difficult. So your environment, the loved ones around you become really, really important. And
Mhm.
I'm very flexible with my patients who say, well, I can't sleep without that night light or
Yeah.
whatever. Great. If
Yeah.
that's going to mentally take you down from threat, because we're not going to win if I put them into a threat state. So
No.
the goal is to find what makes them feel secure in the first instance, stabilize them there, and then work backwards from that point over a period of time. You just have to accept that
Mhm.
sometimes you can't make the perfect cake to start with. Let's
Yeah.
just bake whatever we can and then work to make it the best version as we go on.
Mm. Some very, very important perception shifts that I'm hearing you say, and it's incredible. And I think this safety piece is huge, but I also think this energy piece for sleep is really huge. And not a lot is it spoken about in that way. So I really appreciate you talking about that in that way as well. That's incredible. Um, all right. So I guess you've mentioned one other thing I want to sort of make sure we talk about, because we've mentioned it but not dived in yet, is just these 12 primitive reflexes.
Oh, yeah.
Because we kind of like teasing the ground here if we've said primitive reflexes and then we sort of don't go through it at least a little bit.
Right. So there's probably more than 12, and I focus in my 12-week program on four very specifically.
Okay.
So the first major one that we actually look at is exactly as you're doing right at this moment, the suck, swallow, breathe reflex. And the suck, swallow, breathe is uh, the most important or second most important, depending on where you sit and where the person is on the paradigm at any moment in time. The first one that actually pops up is actually the fear paralysis reflex.
Mm.
But the thing is that the fear paralysis reflex is mum's reflex, not the baby's reflex. So the fear paralysis reflex pops up to protect the mum from threat in her environment. And its effect is to turn down the blood supply to the baby and reduce movement of the baby so mum can run away. So it
Mm.
moves and partitions resources back to mum's system because we are designed, remember, as angry chimpanzees in a threatening environment. So
Mhm.
the chronic issues with the mortgage or arguments with your spouse or difficulty in the workplace or I'm malnourished, whatever it might be, that threat response that activates mum's consciousness to go, I don't feel safe, will cause the fear paralysis reflex to activate, which turns down nourishment to the child.
Mm.
Now, there is all of these massive levels of consequence that go on from there. There's
Mhm.
increased risk of heart disease in the fourth and fifth decades, greater risks of metabolic syndrome and diabetes in the fourth decade. Like we can go to town on that one, but it's the
Mhm.
first one that shows up. Now, somewhere around perhaps the 12th week, it's meant to start evolving into the moral reflex, which is the first major reflex that I focus on retraining. But in between that, the suck, swallow, breathe actually starts because the tongue starts developing at 5 weeks and is fully built by week 20. So
Mhm.
in that time period, the nervous system has grabbed a hold of the tongue and you are starting to make it work because it's a survive or die reflex. If you come out and you don't have a functional suck, swallow, breathe that you can try to get some nourishment, fundamentally from the nervous system point of view of that child, I am dead. So you
Mm.
will make whatever you have work. Now, whether that's a kind of, you know, the baby does not care. It just has to make something work to get some nourishment in because the baby doesn't know that our society has developed all the wonderful technology, great hospital systems, the midwives,
Mm.
bottles, etc., that will help that child survive. That
Yeah.
nervous system, as I said, is a 100,000-year-old system in a modern society, and it is unconsciously believing that I could die if this doesn't work. So
Mhm.
it will change all of the movements. That means it changes the wiring of the nervous system. Now, that means if there is tension on the buccals, on the tongue, shortening of the jaw, which we can see by month 4, you can see retrusion of the jaw caused by tongue tie by month 4 on the ultrasound. Now, that
Mm.
means that that child will be in a survival state unconsciously trying to get something to work. That will change the set point for adrenaline and cortisol in that child's nervous system.
Wow.
Okay. So by week 20, which is halfway, they have to have something working. They spend the rest of the first part of their life practicing. So
Mm.
by the time they come out, they have something to occur. Otherwise, if they discoordinate the suck, swallow, breathe, they can aspirate and they can
Mm.
die. Now,
Yeah.
I'm sorry that I'm so fixated on death. I don't mean to be, but I'm
No,
trying to get the point
it's
across that
survival.
that's exactly it, right?
Mm.
So the fear paralysis reflex in that time zone then converts into the morrow, but a portion of it still exists and it controls the neuromusculature of the airway when you're in REM sleep. And it's associated, if it's dysfunctional, and we have an altered set point for cortisol, with altering the myelination of the vagus nerve and a greater propensity and risk towards SIDS. So for those that don't understand, that's sudden infant death syndrome and the
Mm.
children that stop breathing. And the theory behind it is when they are in stress from their environment, whether they've come out, they're in a difficult space, there's mold in the environment, the parents aren't getting on, they're not getting fed well, like who knows, right?
Mm. Mm.
That poorly myelinated vagus nerve with over paralysis equates to the potential for I cannot regulate my breathing in REM phase of sleep and I cease.
Mm.
That's what the
Wow.
literature is suggesting at
Yeah.
this moment in time.
Yeah.
And
And
it's again,
this is why, sleep-in with children have also been really high on the literature as reduction of SIDS episodes.
absolutely.
Yeah.
You get to see your child and
Mm.
you innately feel
They're
something's not
safe.
quite right,
Yeah, and they're safe
right?
feeling too. Mm.
So Tongue tie, of course, has a great impact on that, because when you over paralyze, the tone drops away. And of course, the airway can be more easily occluded as the tone's dropped out, because the fascia is pulling it into the space, especially if we have a narrower facial structure, smaller jaw, etc.
Mm.
So postpartum, we then have the suck, swallow, breathe, and the child has to, they come out and they use the Moro response and what's called the asymmetric tonic neck reflex to theoretically crawl up mum's body, bind to her, gob the boob, and then activate the tonic labyrinthine reflex. So that is the major ones that I look for in all people, whether it's a child. Now, primitive reflexes, I just need to point out, are completely normal up until maybe 1 to 3 years of age. They should be kind of starting to blend in and be integrated somewhere between 1 and 2 in most instances. The literature says up to 3 is normal. So
Mm.
if we just use that, anything post 3, if you're seeing the Moro response where the child is doing these big startles, etc., or we turn the head and the whole body sort of moves, or we're finding that we start trying to write and we turn the head and the arm will straighten and will go off the line, all of those are to do with primitive reflexes, and they are an aberrance. So primitive reflexes are perfectly normal. But past a certain age, we should have done enough movement to allow the frontal lobes to suppress them. They never, ever go away. They are always there. And if you get tired enough, fatigued, beat up enough, your nervous system will fail to suppress them because your frontal lobes are not engaged enough. Now, one of the most interesting places we see that is in drunkenness. Frontal lobes are now disengaged.
Makes sense. Yeah, makes sense.
The primitive reflexes come back out to play with us. So it also can occur with concussion. But in a child where we shouldn't be seeing any drunkenness and we shouldn't hopefully have had a concussion, if you've got a 5 or a 7-year-old who is having um, issues with like dysgraphia, problems with swallowing, whole body turning, lack of awareness of their body parts and space, clumsiness, these are all associated with primitive reflexes for whatever reason. Now, I believe they will stay there until the threat to the system is past, no matter which one that is. You have to look for what's the underlying problem, remove that, and then train them forward. So again, the first and most prominent threat to life from a baby's point of view is either airway or nourishment. So if there's a tongue tie, it will cause a problem with both potentially. It will fragment sleep, which is why we get these really fractious wakeful children who then can go on to develop things like silent reflux, because the airway occlusion causes contraction of their rib cage, which pushes on the stomach, which is a bulb that causes the contents of the stomach to regurgitate up the throat, because you're just squeezing it nice and tight and straight up the spout it goes. So that can then lead on to things like throat infection, because as the particles go up, they can get lodged in the back of the sinuses and the eustachian tubes, which are almost completely flat in the first couple of years of life. It's only as the head grows that the eustachian tubes start to actually dive down diagonally to allow drainage of the fluids out of the ears. And this starts these really nasty repetitive sickness phenomena, which can then lead on to tonsillitis and adenoiditis and burning of the back of the throat, husky voices. There's a bunch of stuff involved there. But it's all associated with things like the suck, swallow, breathe not working properly, the Moro response being retained, and problems with the ATNR. Now, I should also note the asymmetric tonic neck reflex is essential for yoking up the two sides of the brain, to yoking up your eyes together, to coordinate the left and the right side of the body. So if we don't do that efficiently, we tend to find that things like walking, running, bike riding just don't work well, because we, instead of doing this cross crawl pattern where one arm goes forward and the other leg goes forward, we just
Mhm.
don't do it. And that movement requires both hemisphere of the brain to be active and coordinating at the same time to send their kind of signals at the same time to allow left and right to move, front and back to move all at the same time. So there's a
Mm.
lot going on there, and it's driven by the primitive reflexes. Again, like the ATNR is essential for helping teach the child to crawl. All of the primitive reflexes take the baby from being a blob that relies entirely on its parents, its caregivers for safety and security and movement, to being independent, to go from lying still to being able to sit up, to get into crawling positions, to start to move, and then elevate into an upright posture to be able to walk. That is the whole point of these primitive reflexes. Thus, once you've established good walking, running, etc., you shouldn't need the ATNR to actually be there. You shouldn't need as much of the motor response to be there. Thus, that movement should be suppressing them, because the frontal lobe has wired down to have actual control of your body. And that's the whole purpose of them. Now,
Yeah.
when do we do our most impactful learning?
Yeah.
It's
Yeah.
at night when you're asleep,
That's
right?
right. The energy that's needed for it too.
Yeah. So if you are fragmenting your airway because you're tongue tied, because you've got silent reflux, because you've got low tone in the midline, your ability to get enough quality sleep to harden and lay down those pathways is greatly diminished, which is why it can take much, much longer. And we see this as an elongated problem. Thus, the reason why I would like to see a testing program from newborns, test again at 6 months, look at them again at 1 year, 2 years, 3 years, hunting for tongue and oral ties and breathing airway fragmentation. Because while
Mhm.
I focus on things like tongue tie, it's not the only thing,
Yeah.
as we find with the domestication theory.
Yes. Yes. No, it is
So,
awesome. So I
so
just want to say here quickly that, for all of this, it makes so much sense now to have it laid out like that, and the clues that you can get from clients when you're with them, and it all makes sense. You can see it clearly along the whole path, and then what might be to come for the future, if not it's sort of corrected or supported.
that's it. Now, I should then answer, we didn't answer what I do with my clients, which this
Mm,
is the perfect segue to it. So
mm,
all of my patients, if they're old enough, I will do a visual recording. I use a program called Right Eyes. We measure what their eyes are doing.
mhm,
We do balance and gait assessment with them. We take photos of their posture to look for, are they head forward? Is their pelvis collapsed? Now, this is from however old they are. If they can manage to do the tests, I do a full neurological examination with them physically. We look at things like blood pressures and oxygen carrying capacity around the system, what their reflexes are doing. We do the primitive reflex testing and we grade it. And then we use that as our baseline for where are we at 4 weeks, 12 weeks, however long it actually takes.
mm,
I measure mouth widths. I measure facial structure widths. We look for, can the tongue move appropriately? Do you have enough strength to hold it up in the mouth? Is it spilling over? Are you too narrow in all of those positions? Is your jaw retruded back, etc.? And
mm,
so it doesn't matter what age, we need to catalog that. And I implore all the practitioners who might be looking, if you're not starting to think about these things, or if it's not in your scope, find someone that is, or please start doing it. This
mhm,
this is imperative, because if your face and airway is not working properly, it will affect your sleep, which will affect how your brain wires itself up. So we use all of those things to go, how is your brain functioning at this moment in time?
mhm, mhm,
What do we need to do? What do we need to add? What do we need to take away to bring you to your most open, uh, growth centered self? Because the goal is to get the child to bring themselves to a point that the kind of flower opens, because you're hardwired to do it for yourself, right?
Yeah.
And so that's the cool thing with adults, is that they've got all of the hard wiring there. They've just, instead of going from point A to B to C, they've kind of gone from point A to F to G to B to D to, like, and so it's an inefficient pathway. But when you remove the impediment, whether it's a tongue tie, or we'll send people to see ENTs to have septal deviations corrected, or we'll send them to have adult expansion and things like SAPE done to actually grow the bone structure back
Mm.
to a more appropriate. Because again, if your airway is fragmented as a 50-year-old, you run greater risks of dementia. You
Mm-hmm.
run greater risk of heart disease. You run greater risk of depression, of anxiety, because anything that fragments your airway, fragments your sleep, lowers oxygen carrying capacity to the brain. The brain then has to go, am I more important than my foot? Am I more important? And it has to change the vascular beds. It will tighten things up and it will keep the blood for the brain, because the brain is the most narcissistic thing in your universe. It believes it's the most important thing, along with the heart and the lungs. After that, the brain really drops everything else down. That's why we see symptoms so much more out at the periphery. You get
Mm.
bad skin because you're not sending blood and nourishment to the skin at the extremity. That's why people age on their hands and their feet first. That's why they keep complaining about things like, I've got a fungal infection in my toe. You probably don't. You probably have a lack of blood supply to the nail bed because your brain does not care about your toes, right?
Makes so much sense.
Because they treat it and they
Yeah.
don't get better.
Yes.
So that says that either it's bad treatment, it's not a real fungal infection, or it's some other kind of facility. And again, if that person's stuck in a fight flight, they're not healing anything, are they?
Mm-mm.
Fight flight brings all the blood to the center, it pulls it away from the skin, thus we see the problems. Now, again, if we have a midline structural fault, we're not breathing well at night, we've got narrow sinuses or otherwise, it creates the cycle that goes on. So
Absolutely.
we will then do like primitive reflex retraining. We send them home with things like the 12-week program. We get
Yeah.
them doing exercises like crawling or duck walks or whichever ones. Now, some practitioners are very, oh, you've got to do this exercise very specifically and this exercise. I don't actually believe that. I believe if you've got one of the early gateway ones, which is Morrow, suck, swallow, breathe, ATNR, TLR, or STNR, which are the main major gateways to everything else kind of growing out from there,
Mm.
you have to do enough of them. And our problem is everything's wired up from movement. We just don't know exactly how much movement that is. So everyone talks about like 10,000 strokes or 10,000 steps. It's all made up. Like there's absolutely no science to any of that, but it's a
Mm.
nice number and it's an acceptable number, because if you do enough repetitions of something, it actually starts to wire in. So for some people, we'll send them to get a tongue tie release done and do the exercise, and within 6 weeks, everything's just gone, boop, and they're off and running. And in
Yeah.
other people, it takes 1 to 2 years because their nervous system is just so fatigued because it's been going on so long for them. And that, I think, also has an effect because of their epigenetics and, what other things have gone on in their life prior to that moment. But the idea is you have to find a way to bring them to safety. You have to find a way to get their frontal lobes to engage. You have to give them hope, and you have to make them feel cuddly, right?
Mm. Yeah.
Cuddliness and like the concept of vitamin L, love, right?
Mhm.
They have to love themselves. They have to love outwardly. Now, you can call it whatever else you want, but without hope and without that physical nourishment, touch is essential in this, right? Without that sense of safety, I'm good. It's very hard to rewire a 20 plus year in the loop brain and go, oh, you're going to be fine now.
Mm. Absolutely. So important. And I think that's where the benefit comes from. Obviously, we'll talk about it now, but that sort of like domestic environment, I know it's not exactly about that what you talk about, but that, but also with the relationships that you have in your life, but also that relationship with a therapist, a practitioner, it's so important. It's that placebo impact because of the safety that you've created and the actual hope. It's the love and the hope.
Yep.
Really, really love this. All right. So let's talk about your paper
Yes.
that you're talking about, domestication theory. This has really interested me when you said it right at the start of our chat. So talk me through it.
Okay. So part of the way my brain works is it refuses to accept unprovable problems. There's no such thing
Mhm.
as an unsolvable problem. It just means we haven't looked at it properly.
Yep. Yep.
So when I got interested in things like tongue tie, I was trying to solve my children, for instance, and then
Mhm.
expanding that out to everyone else. So I wrote my book, First Principles, which
Yep.
is about the concept of oral airway functional maldevelopment syndrome, or OFFMS.
Mhm.
So oral airway is here, sinuses, or what a friend of mine, JJ, calls the aerodigestive tract. And
Mhm.
it's
Mhm.
functional because you can get to problems with this area in a variety of ways. You could be born with it. You could have had an accident and broken your face and damaged your nose. It's kind of in whatever way disturbs you from the normal best trajectory for your functional growth, which will interfere with the nervous system, it'll interfere with your oxygen levels, and this all interferes with the brain. So that
Mhm.
was where I was a few years ago. The problem is that it doesn't solve or explain all of our issues. It doesn't explain how we got to the tongue tie. Why did the tongue tie occur, right? It just says that's a problem. So
Mhm.
my
Mhm.
goal and how I started in life from this thing called the Barker hypothesis, which I found out about in 96 when I was at university,
Mhm.
is that the environment and the state. So the Barker hypothesis basically says that the state of health and well-being in the mother in the 2 years prior to pregnancy affects the health outcomes of the child down to the third generation,
Mhm.
right? Yeah,
Oof.
it's a big thing. So I've used that as fuel for all of my thinking because it's been substantiated. So that means we are looking for what has gone on in mum, but it's not just mum, it's mum and dad, because like to make the placenta, 50% of the placenta and all of the hormonal control and regulation and epigenetics and nourishment comes from dad. That
Mhm.
is the sperm in action. Now, if he's got problem with his methylation tags, which actually get picked up by the sperm as it goes through the vas deferens just before ejaculation,
Mhm.
then
Mhm.
we're going to have poor quality sperm making a poor quality placenta, leading to bad nourishment, activating things like the fear paralysis and setting off that
Exactly.
cascade, right?
Yeah. Yeah.
So I have then come up with the concept I call domestication theory. And
Mm.
domestication theory says that our current problems, so it's a framework to understand how all of our health is in decline. So human beings have just lived through the gentlest, safest, most growth focused 80 years of human existence. We've had the least wars, the least death of people, and people are terrified at this moment of how unsafe it is. It's an absolute kind of fascinating scenario. Like, and I think some of that is because we're so cocooned that we don't realize actually how good we have it. But
Mm.
some of the impacts of that cocooning is intensive certification. And the
Mhm.
more intensively we've citified ourselves, living in close proximity with electromagnetic pollution and PFAS chemicals in the water supply, and fluoride and chlorine, which knock out iodine, which affects the thyroid, which affects how the thyroid hormones create the brain in the in utero period, and is associated with lowering IQ, and the amount of noise in our environment, which is shown to create an increase in cortisol in the mum. And so all of that acidification has an impact on the health and well-being of the mother. But further to that, the impacts of acidification have allowed or caused women to choose less violent, less punch you in the face partners. Now, before everyone out there jumps on me and says, that's a misogynistic, you can't say that, I just did, and it's still true. And the reason why it's interesting and true is that because we're in an environment now in the Western world where you don't need a brutish, thuggish, violent partner, you are choosing for different qualities. Even 100 years ago, you were much more likely to be kind of out in a less safe environment and get assaulted. So having kind of a brutish person around to keep you physically safe was much more important. Now we have police and we have kind of less guns around, and we've had, far less things. Now we've got a media that kind of highlights every possible bad thing. And so people feel kind of less safe, but it's not because we are less safe. It's because we know about it more. We didn't have the internet telling us 24/7 what was going on.
Yeah.
So the interesting thing about it, as you choose for greater emotional range, greater intellect, the genes that you select for reduce testosterone, reduce aggressiveness, but that reduction causes a delay in neural crest cell migration, which is stem cells that come from the neural cord, which becomes the spinal cord and the brain, and they migrate forward to form your cheeks, your nose, your chin, your tongue, and then at week 5 break off to become the thyroid, which is also part and parcel of this. So there is a consequence to having a less violent partner. Now, again, I'm not saying any woman out there shouldn't want a better quality of spouse, right? I
Yeah.
don't think anyone should be being punched in the
Look,
face.
that's not the point.
No, but if we don't look at it for what it is, that there is a genetic consequence to it, because the gene for X also has kind of Z and F plus and all these other things on that chromosome, and that causes smaller facial features, smaller jaws, smaller airways, less strong cartilage. It also causes elongation. So fundamentally, there's a whole bunch of research that basically points to these prolonged adolescence. So we don't cognitively mature in the same way. We aren't as the males. So it's called a loss of dimorphism. So females are less kind of traditionally curvy female, and the males are less kind of angular, strong. We're getting a physical occurrence of similar body structure. Bluntly put, and again, I'm not trying to offend anyone, but this is what the research says, more blobbiness. And if you actually look out in our society, the statistics for greater amounts of weight gain, greater amounts of diabetes in like 7-year-olds, all of this is occurring because of our intensive urbanization. We're actually less threatened, but more stressed. And with the stress, we hunt for more carbohydrate-laden foods, not made any better by our food manufacturing scientists out there choosing to make hyper-palatable, highly hyper-processed foods that have the right crunch and texture and sweet and salt and you name it. And I used to think those people were evil, right? But they're not. They are just doing their job. Their job
Trying to
is
do a better job.
to sell the product, right?
Yeah.
So it's up to us to change our environment. And that's what everything comes down to, is it's not blame something. It's how do we make our environment more suited for humans? Because we are developing in an intensive evolution. So we're not evolving in a normal kind of 100,000 year cycle. We've evolved rapidly. In the last 80 years, we have had a massive decline in our physical structure of face. We've had a massive decline in our neurocognitive function. 40 years ago, it was 1 in 10,000 for ASD. It's now 1 in 34 in most Western worlds, right?
Yeah.
That is not better diagnosis. There is something affecting us, which I believe is the framework is domestication theory. And the whole point of domestication theory is that intensive urbanization makes us make different choices, exposes us to different physical threats and pollutants that you go back 1,000 years, we didn't have the PFAS contraceptive medication, we didn't have the fluoride in the water. Granted, look, I'm not saying that drinking pollute water is such a great idea. Do I want clean water? Of course I do. It's not like I want to give up the benefits of the city, but what it's kind of saying is we need to give greater consideration to those pollutants, our urban environment, our amount of physical activity, the amount of toxic pollutant light. So instead of, like, a lot of this has gotten worse since our government's decided that we wanted to have cheap light sources, right? So the cheap LED light source has intensified the amount of blue light exposure that is negative for our genetics, right?
Absolutely.
It affects your melatonin, your circadian rhythm cycles, and therefore all of your hormonal cycles, the amount of cortisol, stress, etc. The amount of noise from our environment increases the cortisol, which affect, and it just has all of these doom loops that affect one way or the other. So again, the problem is I'm not saying we should be giving up cities. There's a lot of great benefit to city because the city gave us the capacity to specialize. It gave me the capacity to do the research and the work that I'm doing because I'm not being a subsistent peasant farmer, right?
Yeah.
But we need probably more, live environment within our urban reclines. We need to be making those Sora bulbs readily available. Instead of it being a cheap 3-watt bulb that's full of nasty blue light and electromagnetic pollution, we need these very specialized bulbs, or we need to go back to incandescent light bulbs that have a much more gentle effect on the system. There's lots of things we can do. And the point of domestication theory is I don't have all the answers for what those stressors are, but they fit into that box that says the city environment is what is negatively impacting us, creating us to be not fit for purpose, which is survival and growing decent humans. That's our innate purpose. All those other things we do, like making artwork or a building or, research, that's all on top of growing decent children and raising them to be decent humans. That's what I think is the most important. So we need to be looking at that environment that we find ourselves in and try to make better choices and changes.
Yeah. And people to educate those changes and support those changes, like yourself, and to bring these ideas to the world like you have. What an incredible mind that you have. I am blown away. I'm so happy I found you to actually have this conversation and to be privy to your knowledge and to see it presented in this way. I think I will be following everything that you do for sure from now on.
Thank you very much.
I would love to see what else is to come. So that's it makes so much sense, Scott. It's so much.
That's kind of the key is that it has to make sense, because if it doesn't, then I've got the model wrong. But again, if people have other things that they can help me and say, well, look, I think that needs to be in the model, please send it to me, right? As I say, it's a framework. It just needs more data poked into it for things that we need to look at. And then we kind of need to make this grassroots groundswell of people coming together to force governmental change. Because the problem that we have is that all of our societies, in my opinion, I'm going to get really bad here, they've become fascist. We have big business and big government telling us what we need, not us saying we need better environments, please. It's
obvious.
Corporatism and money is leading everything, which I'm not super keen on.
No.
Now, I wasn't meaning to get political, but
it's got to do with our health.
please come together. We need these groups so that we can actually become big enough to push back against the corporatism that has become our governments.
Yeah, I totally am there with you on that. Absolutely. So, Dr. Scott, I have taken enough of your time and you have so graciously given it to me. So, thank you so much. I want to mention, and you can add to this list, but your book, First Principles, which you've shown and mentioned, your brand of supplements, Optimal Sleep Airway Health.
Absolutely.
Yeah, your clinic, Advanced Rehab. So that is there. And I'll put all these links in the show notes as well. And you also have OptiHuman, which is your courses, and yeah, so many things you're doing, and you're writing papers. Wow. So thank you so much. I really appreciate my time here with you today, and I am sure that everyone is going to get so much out of this as well. So thank you so much.
You're most welcome. Thank you very much for having me.
It's an absolute pleasure. Thank you so much for joining us for another episode on the Smarter Not Harder podcast. And we are incredibly grateful to Dr. Scott and sharing his expertise on primitive reflex integration, neuroplasticity, holistic approach to human healing, nutrition, and creation of an amazing brand, which blew me away. The purpose behind it, so much more than I had thought, of just the ease of integration into a routine and getting children to actually consume medicines in a nice way. So very profound. And his component and looking at this domestication theory was a fascinating end to this conversation and left me thinking for the rest of the night. So really, really enjoyed these conversations. I hope you do too. And if you found today's conversation valuable, we'd love for you to leave us a review, share, like, and share this episode. You can find it on Apple Podcasts, Spotify, or your preferred platform, as you know. And your feedback also helps us reach more curious minds. So tell us what you want to see, and don't forget also to subscribe on YouTube. We have a lot more short videos coming, so stay updated on all our latest episodes there as well. And thank you so much for joining us. Until next time, stay curious, keep learning, and we'll be back with another episode of our 1 cent solutions to our $64,000 questions. All right, have a good night or day, everyone.